I caught up with Harley Street specialist Dr Aamer Khan from Harley Street Skin to discuss all the changes that our skin goes through when we're going through the menopause. It was a busy day, it was a busy street, and it was a little bit noisy, but have a listen.
Obviously the menopause occurs when you hit the sort of 50 bracket, but our skin changes in the build up to that, doesn't it?
Yeah, it does. There is a natural aging change, and the aging process starts at about 35, so our skin starts to change, and it's all linked to how our hormonal balances change as we get older. And women typically at the age of 53 go through the menopause, but it can be anything, from their mid-40s up to their 60s.
And what sort of changes do women see? Because it happens in different cycles and different stages, doesn't it?
Yeah, it does. I think to try and understand what's happening, it's important to understand what happens during the menopause. So what we see is, as we go through the menopause, the process that we call perimenopausal, there are lots of changes.
Yeah.
And that's when you get vascular changes with hot flushes, you're starting to get drier as the estrogens go down. But what happens is there's an imbalance of the estrogens and the androgens. So you can enter a stage where you start to become quite oily, quite spotty. And I call this the second teenage phase.
As if it wasn't bad enough, you get teenage spots again. And is it true that if they appear sort of around the jawline and around there, that's hormonal spots?
Yeah, I think acne is always hormonal, but when we're very young, there's a bacterial element to it.
And what sort of things can we do? Because obviously as women going through that changing process, and we notice that our skin is changing, quite often we find a skincare regime that we sort of take on in our teens or 20s and we stick to that. Do we need to start adapting what we're doing to our skin?
Absolutely. Our skin's reflecting what's happening inside, and our skincare should reflect what's happening to our skins. So as we get older, particularly with women and their hormonal changes, there is a dryness in the skin. So there are three things that we've got to think about. As skin gets older, the epidermis and the dead skin layer starts to build up because there's a slowing down of cellular turnover.
Okay, so that's the top layer of skin.
That's the top layer. So that will lead to discoloration where the dead skin piles up, and if there's some sun damage, the darker spots will become darker, the skin will appear more coarse and less radiant.
Okay.
So there's a dullness to the skin. Also dehydrated because the dead skin layer doesn't have much moisture in it. The dermis, where the activity, cellular activity is, that will start to thin out because there's less cellular activity.
Okay.
That's where the collagen is produced and the hyaluronic acid is produced.
Yeah.
So there is a physical reduction in the amount of moisture in the skin as well.
Okay.
But also the dermis is involved with the immune system in the skin. And after the menopause, there's an increase in the immune cells, and there is an increase in sensitivity of the skin as well.
So we're not imagining it, because I think a lot of us, we get used to looking at a certain face in the mirror, and suddenly you look in the mirror and there's your mum, which is lovely, mum, if you're watching. But it happens so slowly that you don't always necessarily see that your skin is changing. It's starting to droop, like you say, it's losing its sort of luster a little bit. You mentioned that your skin is a reflection of what's happening on the inside. What can we do on our insides to take care of our skin on the outside?
I think this is something that's important throughout life. A good, healthy, balanced diet, good exercise, that all balances out to give you better health.
Yeah.
I think there are other hormonal changes and digestive changes as we get older as well. So particular supplementation is also going to help.
Okay.
Because there is an increase in the inflammatory factors, then antioxidants are very important.
Okay.
So we can look at an antioxidant diet with lots of fresh food, fresh fruit, fresh vegetables, having a rainbow of colour on your plate, and taking supplements which have that as well.
And what sort of supplements? Because we all, you walk into the chemist, you walk into a health food shop, and you're overwhelmed with choice.
It's difficult out there because a lot of the supplements don't do any good because we're not absorbing them. They're not presented in a biological or bioactive way.
Okay.
A lot of the supplements aren't taken in a way that we're going to absorb them because we've got to understand that our bodies and our digestive systems aren't switched on all the time.
Right.
So the sight of food, the smell of food, the taste, the actual chewing of food and the swallowing switches on the various receptors and the various enzymes which actually absorb the nutrients. So taking nutrition with food is really important.
Okay, don't just have a rubbish diet but think, but I pop a few pills so it'll be okay.
Yeah, absolutely.
Right.
And all we're doing with supplementation is adding to a good diet according to how we're changing. So antioxidants are really good. The other thing that changes also is how our guts deal with nutritional uptake. So we start to become deficient in certain vitamins and minerals. Vitamin D particularly starts to go down in women as we get older.
Okay.
So taking a vitamin D supplement in a bioavailable form is really important. So if you're really serious about having supplementation, then get advice from somebody who knows what they're talking about.
Okay.
Either a doctor who has a specific interest in nutrition or a nutritionist.
So going back to that's what we put in our bodies. What about what we put on our skin? Because you mentioned that obviously that the sort of top layer of our skin is losing its luster and it's becoming dull. Does that mean then we're talking scrubs and face masks and this sort of thing? What should we be looking out for ingredient-wise?
I think exfoliation is important. However, I've already mentioned that there is an increase in the inflammatory factors in the skin.
Okay.
So if we're too rough with the skin, we're going to go red and inflamed, and that can cause all sorts of problems. And that can even lead to scarring and damaging of the skin. So gentle exfoliation with alpha hydroxy acids and beta hydroxy acids, AHAs and BHAs.
Okay.
And they're really important. Something like glycolic acid would be really nice, because that gently breaks down the glue between the dead skin cells and allows you to exfoliate naturally, and that then increases the turnover of skin cells as well.
You mentioned that obviously our skin will go through different phases, so it will become oily and then it will transition to becoming dry. Is there anything that we should avoid, obviously during the oily phase and then during the dry phase?
Yeah, I think we should manage our skins properly, and again, getting advice and getting the products from the right people is important. During the oily phase, we don't want to be putting any oil-laden moisturizers on our skin. We've got to remember that oil-free is the important word to use, the important phrase to use. But dryness doesn't just happen on our skin. Women find dryness everywhere. Everywhere dries up and sort of dries out. So hydration is important internally. Using things like hyaluronic acid in products will hold moisture to the skin. But it's also important to increase cellular turnover. So we talked about the different aspects. We've already covered the build-up of dead skin. So if we get rid of that, there'll be more moisture, more suppleness in the skin. The other is inflammation. Using products with anti-inflammatories in, like vitamin C and other peptides.
And that's topically, not taking internally. Topically.
Absolutely, that's topically. So this, on top of taking anti-inflammatories internally, using topical anti-inflammatories will help as well. The other aspect is cellular turnover, because that dermal layer is thinning out. To have good, healthy young skin, which is turning over at a healthy rate, we want to stimulate that. And we want to increase energy in the skin as well. So in order to stimulate that, we need to have peptides which mimic hormones. So they'll mimic estrogen, they'll mimic the other hormones, growth hormones and peptides within your products, and they can be delivered to the right level. And of course, vitamin B3 is great for charging up the energy parts of the cells, the mitochondria.
Now, obviously, we're at Harley Street. This is a centre of excellence in terms of dermatological skincare. But if someone is looking on the high street or thinking, right, this is my budget, this is all I have to spend, is it relative that the more you spend, the better the product will be, or can you still get good skincare but not for a huge price?
The whole philosophy of our products is to get them out to everybody, so everybody can afford them. And our strapline was to get Harley Street to the high street. And our products, so they have all the right ingredients in and they've been formulated by us, they're not necessarily expensive. You can buy products which are 3, 4, 5 times the cost, which don't have the products at the right level in. So I think it's important to get scientifically developed products by people who know what they're talking about.
But obviously you go into any department store and there are some incredible brands out there, who have the shiny stall and all that, and they are charging an absolute fortune for skincare. And many women, especially middle-aged women, will think, do you know what, if I throw £100 at a pot of cream, that's going to be my saviour. Is that the case in some instances, not in others?
They could work. I mean, some of the products are very good out there.
Yeah.
I think what we need to look at it, and a lot of the products may have a doctor's name behind them, which is an endorsement. It doesn't mean to say that that doctor has developed that product,
Sure.
or even that doctor has the knowledge to be able to develop that product, because they may be in a completely different field. So I think it's important to do a little bit of research, see what the development behind the products is and who's actually formulated and developed them.
Yeah.
And you can get some very, very reasonably priced products out there which are excellent.
Which will do the job.
Which will absolutely do the job.
Finally, if there was one tip that you could give the This Girl is on Fire community about looking after their skin, what would that be?
Just one tip?
All right, I'll give you a few.
Well, I think we more or less covered it.
Yeah.
I think it's important to understand what you're going through. A lot of the anxieties are around experiencing something you haven't experienced before.
Yeah.
And having a basic understanding of this is a natural process. This isn't a disease. It's not a condition. It's a natural progression to the next stage. And the menopause, once we've gone through it, if we manage it properly, doesn't have to be stressful.
Yeah.
And once we're through it, then we can have a life at the other side as well.
Looking great, because you looked after
Looking
your skin.
great, feeling great, and maybe even feeling better than we did when we were in our 40s and 50s.
I think that's a good place to end, don't you? Thank you very much, Aamer. Thank you for taking the
My
time to
pleasure.
talk to us today.